It's not often that you see Catholic nuns posing for photographs on a locomotive. These are Ogden's own Sisters of St. Benedict. Their predecessors stepped off the train right here 65 years ago when they came to the Rocky Mountains from Minnesota to build a hospital.
People say, well, when are you going to retire? And then I say, well, what for? Because it's true. We value the opportunity to be there with patients and family. In fact, just now, it was a family, a young 15-year-old who had a very traumatic experience way out in Randolph. And so I was just able to tell him, you know, we're here to care for you, and we're so glad you came to us because we can care for you. And he said, oh, all right.
We continue to say that we are effective because of the foundation that was laid by the sisters who came in the 40s. They were strong women, and I think they knew what the role of Benedictines would be in this community.
And I can still see them walking in their white habits and them wrestling because they were so stiff. When you'd hear that wrestle down the hall, you knew it was either a St. Benedict's graduate or a sister that was coming to take care of you. And people listened for it. It's amazing.
Because of its heritage, because of the continued presence of the sisters and what they bring to this hospital, there is an extremely nurturing and healing environment that is here.
We pride ourselves on that soft touch. And patients have told me over and over again, I love coming here. I love this hospital. You know, you make it wonderful to be here.
You can't run a hospital without well-trained nurses. So in 1947, the sisters opened St. Benedict School of Nursing. And for the next 20 years, they trained nurses to work in hospitals all across the West.
We had excellent teachers. We had physicians that taught us. We worked in the evenings from when we were what we call probies after the first few months, 6 months of being in training. Then we started working on the floor, kind of like aides, and then progressed as our education progressed.
In the 1970s and 80s, many small community hospitals like St. Benedict's can't keep up with the high cost of new medical technologies and are acquired by large healthcare corporations. But under the sisters' careful and prayerful guidance, the new St. Benedict's invests in the best equipment available and dramatically expands services. But they don't tamper with that unique St. Ben's spirit.
When I say to them, is there anything I could do for you? You could offer a prayer with us. You could remember us in your prayer. Just your being here is peaceful for us.
But by the early 1990s, the demands of running the hospital are too much, and the sisters make the painful decision to sell St. Ben's. Several sisters remain on staff under the new ownership, and 3 sisters still work there today. For many in Ogden, it will always be St. Benedict's, but the official name today is Ogden Regional Medical Center.
Even though Ogden Regional Medical Center is no longer a Catholic hospital, the spirit of the employees there and the kind of care that they give is a tribute to the sisters.
I wouldn't work anywhere else. I think it's a wonderful institution. I feel uplifted when I come here, and if I have a day which I don't run into one of the nuns, I feel it's a day deprived of that spirit.
I remember the early years I was here, they always referred to the hospital, it was almost like a family. And that was because this whole philosophy of the sisters that serving people as Christ in person had filtered through, and they knew what that meant.
It's amazing. Every day you come to work and know you're standing on their shoulders. And the whole culture that you feel, I feel the responsibility to maintain and uphold and enhance what they started here.
The Sisters of St. Benedict came to northern Utah 65 years ago to build a much-needed hospital during a desperate period in American history. They did more than that. The sisters built 2 hospitals, trained 350 skilled nurses, led the way in the transition to technology-based health care, supported dozens of community charities, and created a unique regional medical community with a reputation for technical excellence and loving personal attention to patients and their families. Today, the Sisters of St. Benedict continue to bless Ogden Regional Medical Center with their powerful and gentle spirit of healing. They truly care for the sick as if they were Christ in person.